Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, June the 8th, 2020. Joining us today, Mayor John Tory, Toronto Medical Officer of Health, Dr. Eilleen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you, and good afternoon. And I'd like to start today with a few comments about some of the events over the weekend when a number of peaceful protests took place against anti-Black racism and anti-Indigenous racism in our city. I want to thank people for coming together in the Toronto way to constructively call for change. We have heard that message loud and clear. We know that anti-Black racism and anti-Indigenous racism exist, and other forms of racism as well. They exist in our city and in our country, and we are committed to confronting them and to ultimately ending all forms of racism. This is an absolute determination of mine, and it is shared, I know, by all of my colleagues on the City Council. I met last week with our Confronting Anti-Black Racism Unit, the first of its kind in any city in North America, to see what we could do to speed up their work and to assist them in that regard. I'm also reaching out to community leaders to hear directly from them about how we can work together to stamp out systemic racism. Today, the Board of Health, chaired by Councillor Joe Cressy, recognized anti-Black racism as a public health crisis. As the board heard today, Black Toronto residents are more than twice as likely to be living in low-income households than residents who are not from a visible minority. And 44% of Black children live in poverty compared to 15% of non-racialized children. Black women in Ontario earn 57 cents for every dollar that a non-racialized man earns. Black people in our city experience racial profiling and anti-Black discrimination within our institutions, along with higher rates of precarious unemployment, significant poverty, and overrepresentation in the criminal justice, mental health, and child welfare systems. We know from Dr. de Villa that COVID-19 is hitting harder in communities with higher percentages of visible minorities. These facts of life are unacceptable and need to change. I support the Board of Health's direction to ask Dr. de Villa, through the 2021 budget process and COVID-19 recovery planning, to make recommendations to the Board of Health on reprioritizing City of Toronto resources to address better the social determinants of health, including, specifically, a focus on anti-Black racism. This will go hand in hand with the establishment of and the work of the Confronting Anti-Black Racism Unit within the City Government. We are also committed to continuing to modernize our police service and ensure that it is the most accountable police service in Canada and free of bias when it comes to policing. That's why carding was ended. It is why we finally agreed, after many years of debate, to collect race-based statistics on policing. And that's why we approved the implementation of body-worn cameras for officers last year, and why we are now working to fast-track the rollout of those cameras this year. Over the last 5 years, I've been privileged to work with Chief Mark Saunders on the modernization efforts of the Toronto Police Service. On our watch, these modernization efforts have significantly expanded community policing and the increased use of technology and civilians, all within an average budget increase of 1.6% per year, less than the rate of inflation. Today, Chief Saunders announced that he plans to retire on July 31st. About a week ago, Chief Saunders came to see me to let me know that he planned to retire this summer. This retirement comes after more than 37 years in the Toronto Police Service. So on behalf of all Toronto residents, and we'll have more chance to talk about this later, but I want to say a simple word of thanks to Chief Saunders for his exemplary service as Chief, but also over all of those years of service to us and to our city. He has led the men and women of the Toronto Police Service, and this is a very difficult and challenging job anytime, but he has led those men and women for the last 5 years, working to modernize the police service and to establish community-focused policing. Prior to that, he held just about every leadership position available in the Toronto Police Service. He has been a dedicated and responsible Chief of Police who has always worked to protect the well-being of the residents of this city. He cares deeply about the people of the city and its neighborhoods and about the men and women who served him. I know that Mark is looking forward to spending more time with his wife Stacey and his children. I wish him all the best in his retirement from the Toronto Police Service. I believe we will continue to see the benefits of his pioneering work for many years to come, and the change in culture that he's begun to bring about in the Toronto Police Service. This afternoon, the province of Ontario announced the next phase of its reopening plans. City staff have been working non-stop to get ready to support this reopening and to support the people who will be affected by it, people and businesses out there across the city. We appreciate the province's sensitivity to regional concerns. These concerns were raised by me, by our medical officer of health, and by the region's mayors and medical officers of health together. This will mean some businesses could reopen here as early as June 19th, just a week after businesses in other parts of the province, but reflecting our paramount concern for public health. This is a responsible decision from provincial officials and recognizes that we must continue with this reopening in a safe manner based on principle of public health. I want businesses to open as soon as it is safe for them to do so, and we are doing everything we can to make sure the city government supports the reopening. Since April, the City of Toronto has been hard at work planning for the eventual restart of our services and the reopening of the economy. The Toronto Office of Recovery and Restart was created, led by Saad Rafi, to ensure that we can safely reopen as the provincial orders are lifted. Last month, the Emergency Operations Centre, led by Chief Pegg, created a restart roadmap to help guide the restarting of city operations so that those operations could continue to serve people but also support businesses in the safe reopening of their operations, and for residents as well to make sure that they are able to take advantage of those returns of city services in a safe way. The Toronto Office of Recovery and Rebuild is working directly with each city division and agency to make sure that they are ready to restart any and all services. Over the past month, the city has already implemented the reopening of some sectors, such as curbside retail pickup, curbside pickup at the Toronto Public Library, and the reopening of some parks amenities. And last week, the city outlined public health guidance for the reopening of dine-in restaurants and personal care services. I want to thank Attorney General Doug Downey, the Attorney General of Ontario, for announcing today that the Alcohol and Gaming Commission of Ontario will be cutting red tape for patios. This was a necessary step the provincial government had to take to give life to our proposal to allow for the extension and expansion of patios, both to create a more pleasant summer environment, but also, of course, to help these struggling businesses as they start up again. This was the Provincial Attorney General's action in direct response to a request that I had made, and I believe this will help our restaurants and bars to recover. So thank you to the Government of Ontario for that. We will have more details in the coming days on the city's restart plans for Camp TO, a plan to help kids safely go to day camp this summer, and for Swim TO, our plans to reopen pools and other aquatic facilities. Some of these things have been altered and timing has been changed because of the pandemic and some of the consequences of that, but these programs are moving forward. The plans are complete. The preparatory work has been done to make sure, most of all, that kids and families stay safe, and the details will follow shortly. We will continue to work with the province and with businesses to monitor the spread of COVID-19 and to ensure that the dates and the timelines of reopening and restart are safe for city staff, for businesses, and for our residents, and to make sure that these timelines are communicated widely. And we're working very closely as well with our regional partners in this regard. The bottom line is that the reopening and the restart are happening, that we are working well with the Government of Ontario to make sure it happens in this region on a basis consistent with public health and on the assumption that everyone is ready. Now, today the Government of Ontario also announced that they will ban all commercial evictions during the pandemic emergency. This ban is absolutely the right thing to do. I strongly support it. I have called on for it repeatedly, and the City Council has requested that the province take this action. And so I want to thank Premier Ford and the provincial government for introducing this ban to help protect businesses in Toronto and indeed across Ontario. Over the past few months, I've advocated on behalf of commercial tenants by calling for a ban on commercial evictions as a way to provide relief for businesses during these challenging times, or at least to perhaps lever some action from landlords to make sure that they provide that relief to those businesses. This form of support will help businesses who are struggling to make arrangements to pay their rent or to continue to pay some part of their rent and to make sure that some other part may be made allowance for given the impacts of COVID-19. Earlier in the pandemic, the province announced a ban on residential rental evictions, which continues to help residents who have lost their jobs due to the pandemic and have trouble paying their rent. In a number of my conversations with the Premier, I've made it clear that a ban on commercial evictions was the next step to take in protecting businesses in our city. And again, I thank him for doing that, because businesses of all sizes across the city have been at risk of shutting down or have already experienced huge financial losses due to COVID-19. Removing the worry of being evicted during the course of the pandemic in these difficult times will help allow businesses to stay open as we transition into this reopening phase of the pandemic. I continue to call on landlords to do everything possible to support their tenants and to apply to the Canada Emergency Commercial Rent Assistance Program. If landlords had chosen to cooperate in this regard much sooner on their own, then the measure undertaken by the Government of Ontario today to ban commercial evictions might not have been necessary. As I've said before, it's better to have a tenant who will pay their rent when they can, as opposed to having no tenant at all. And that was where we were headed in far too many cases. I'm confident that today's provincial announcement will help protect our main streets and make sure that we are in a very best position we can be in for a strong recovery. Finally, the Greater Toronto and Hamilton area mayors and chairs met again today and pledged to support the continued reopening of the Ontario economy. We are grateful for the sensitivity that the Government of Ontario has shown to regional concerns particularly prevalent in the GTHA. The GTHA mayors and chairs also stressed the need for emergency financial support for municipalities, cities and towns, big and smaller, which are all suffering from the effects of COVID-19. Municipalities have been on the front lines of responding to COVID-19. Fighting the pandemic has led to billions of dollars in revenue losses and additional costs for cities and towns of all sizes. While the Government of Canada has pledged some support through its Safe Restart Agreement, and I've just come off a virtual meeting with the Finance Minister and the mayors of the biggest cities in the country, the funding that has been put forward as a first move by the Government of Canada relies on continued negotiation with the provinces that have yet to be successfully completed. In fact, they haven't really been properly conducted at all as yet. We urgently need the province of Ontario to act now to pledge money for Ontario municipalities, all of them, and to conclude an agreement with the federal government on sustainable funding for cities and towns. On June 1st of this year, Premier Doug Ford said, and I quote, "I have committed to come to the table and help these municipalities, and we will," closed quote. Now, in light of last week's first move, and that's all it was by the federal government, cities and towns across Ontario need to know what contribution the province of Ontario is going to make to assisting with the financial crises being faced by those cities and towns, including the City of Toronto. Municipalities across the GTHA need this support as soon as possible, especially as we move to open up more municipal services as part of the Stage 2 of the reopening and recovery. This is not just a Toronto problem. The Toronto problem is very big because we run a very big city here with many complex services. But the financial impacts of COVID-19 will impact many hard-hit municipalities, including but not limited to Brampton and Mississauga and Markham and Vaughan and Hamilton and other cities and towns right across the province. The GTHA is the economic powerhouse of the entire country. And this region led Canada and led Canada's economy before COVID-19 and will be absolutely crucial in leading the economic recovery out of COVID-19. We are urging the provincial government under the leadership of Premier Ford and the federal government under the leadership of Prime Minister Justin Trudeau to sit down and negotiate an agreement now, which will result in immediate action to help municipalities, all of them, big and small, cities and towns. The time for action is now. Just as all governments have moved with lightning speed to respond to the threat of COVID-19 and to assist other groups and individuals, those two governments, federal and provincial, across this country, and here in Ontario in particular, must move now to stabilize municipal finances so that we can all focus on leading the greatest economic restart in the history of Canada. And that is our objective, to focus on leading a restart that is sensitive, that is sensible, that is measured, but that is the greatest economic restart and recovery in the history of our country. On that note, I will ask Dr. de Villa to provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 169 new COVID-19 infections in Toronto, 57 of which are related to a delay in reporting to public health of previously identified infections. To date, 9,746 people have recovered, an increase of 123 since yesterday. For more detailed data on the status of COVID-19 cases in our city, I encourage you to visit our website. Earlier today, our Board of Health met virtually, and one of the items discussed was our current COVID-19 response and recovery. As part of the presentation I delivered to the board, which will soon be available online, I provided an update on the budget impacts of COVID-19, our data and our response, and the provincial and city recovery and rebuild processes. I also shared an update on indicators that we are using to monitor our progress to meet our 3 key COVID-19 response objectives: to prevent loss of life, to preserve the capacity of our healthcare system, and to minimize social, economic, and broader impacts of COVID-19 on our city. COVID-19 has drastically altered all of our lives, and tragically, many of us have lost friends, family, and other loved ones to this virus. However, we have experienced fewer fatalities than originally forecasted, and thus far have averted what could have been much worse. Implementing our public health measures also had a positive impact on our healthcare system and its resources, which have continued to have capacity to deliver care to those who need it most. As I have just mentioned, there is a third objective to our response, and that is to minimize social, economic, and broader health impacts of COVID-19. All orders of government have implemented temporary measures to address this area, whether it be through deferring tax payments, income supports, and other forms of tax relief, to name just a few. However, we know that achieving this third objective will involve gradual reopening of our community and learning how best to coexist safely with COVID-19. Earlier today, the Premier announced that the province will be moving into Phase 2 of Ontario's recovery framework. While our situation here in Toronto is certainly improving, and we have made significant progress, other locations in Ontario with much smaller populations and very different circumstances are at a different point in their outbreak than we are. Given this, the province has indicated that Toronto, along with all the other communities in the Golden Horseshoe who are experiencing similar circumstances, will move to the second phase at a later date. In order to move forward to support our city to safely reopen, we will use this time to help our local businesses, such as restaurants and hair salons, and other community services and amenities, including our libraries and our pools, to best prepare to reopen when it is safe to do so. We are continuing to observe and use the best available evidence to develop public health guidance to share with these businesses and settings. For these sectors to safely reopen, operators will need to implement physical distancing measures and follow strict infection prevention and control precautions, including the use of face masks and coverings to prevent the spread of COVID-19. As we continue our COVID-19 response, we are also looking to identify people at highest risk of acquiring COVID-19 to implement upstream prevention actions to reduce virus spread in our city. These steps are critical to ensure our continued progress and to help prevent a spike in COVID-19 activity as much as is possible. We need to continue to protect our healthcare system and our community. I know that we all want to get back to enjoying our province and our city. I look forward to this too. However, because COVID-19 does not impact all communities in the same way, we need to keep looking at our own unique local circumstances to inform our approach for safely reopening. The plan to reopen should be gradual and based on what is happening in our city. As we begin to ease our public health measures, we will all be living in a new normal. Our commitment is to minimize the impact of COVID-19, especially on our most vulnerable residents, while reducing negative social, economic, and broader health impacts on our community. In the coming months, what this means for residents is such things as continuing to work remotely wherever possible, maintaining physical distance from people outside of our households, avoiding crowds and congregations in closed indoor settings, wearing a cloth mask or face covering where physical distancing is difficult to maintain, and increased diligence on all of our parts on staying home whenever we are sick for any reason. It is also important to note that as businesses and activities reopen in our province and people move around and interact with each other more, we will likely see more COVID-19 activity, even if we all diligently follow public health advice. This has been the experience in jurisdictions all around the world. Until we have a treatment or a vaccine, we should expect that this will be the case, and physical distancing will continue to be a part of our lives for the foreseeable future. As we continue to move forward, your individual contributions continue to be central to our success. Please remember that all of your efforts are worth it. Every action you take brings us one step closer to getting our city back. So please, continue to practice physical distancing, and please continue to take care of each other. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. Throughout the COVID-19 emergency, our teams have worked non-stop to ensure that Toronto responded in a timely, coordinated, and effective manner. Our strategic priorities have guided each of our decisions and have never changed throughout. The Emergency Operations Centre has worked non-stop for the past 90 days to translate the advice and guidance of Dr. de Villa and Toronto Public Health into action that achieves our strategic priorities. As Mayor Tory explained earlier, our priorities are preventing the loss of life, protecting the healthcare system, and protecting the economic and social fabric of Toronto. As we continue to transition from emergency response to city restart, I'm pleased to report that we have developed a responsive and robust city restart methodology. This is enabling city divisions, agencies, boards, and commissions to restart their respective services in an effective and efficient manner. These processes, which we refer to as the City of Toronto Consolidated Restart Roadmap, assists each service area lead in ensuring that each of the required assessments and plans are completed, as well as being reviewed and approved by our strategic command team. Once approved for restart by the province, our teams are able to proceed with various service level restarts in a timely and coordinated manner. This is as a result of the bulk of the preparatory work having been completed proactively and in advance of the anticipated restart approval. Of course, our processes have been scaled to match the demands and timing associated with this global pandemic. Once the required assessment and plans have been completed, the appropriate division or agency head is scheduled to present their respective service restart plan to our strategic command team for review and approval. We are maintaining live time tracking and management of each service level restart across the entire City of Toronto. Of course, while the City of Toronto Consolidated Restart Roadmap processes are underway, our EOC continues to respond to issues as they arise and continues to operate key functions, including our Personal Protective Equipment Task Force. It is important to note that Environment and Climate Change Canada has issued a heat warning for both June 9 and June 10. Many facilities that were part of the city's 2019 heat relief network of cool spaces across Toronto are presently closed due to COVID-19. For this reason, the city's heat emergency plans have been modified. The plan includes 14 emergency cooling centers that will open across Toronto during heat warnings. The 14 emergency cooling centers will offer an indoor, air-conditioned place to rest and to receive a cool drink. Staff who are trained to assist residents affected by the extreme heat will be available, and of course, infection prevention and control measures will be in place. The 14 emergency cooling centers are available to residents who do not have access to a cool space and who are unable to keep cool in their home or outdoors. All of the emergency cooling centers will operate during active heat warnings from 11 a.m. until 7 p.m., with the exception of Metro Hall, which will operate 24 hours a day during heat warnings. An interactive map is available to help those looking to cool off and locate an emergency cooling center location near them. These tools are available online at toronto.ca/keepcool. I would like to thank the many people who are working tirelessly to ensure that these processes take place as quickly, safely, and efficiently as possible. I remind everyone that toronto.ca/COVID-19 is the best source for up-to-date information on COVID-19 in Toronto. In closing, I would also like to take a moment to acknowledge and thank my colleague and friend, Police Chief Mark Saunders, who announced his upcoming retirement earlier today. Mark is someone who is not only a colleague, but also a friend. There has been many a long day and many a late night where I've been connected with, if not standing beside Mark, as we've managed difficult and significant incidents across Toronto. He is a consummate professional who never stops caring for both his officers and staff, as well as for every resident of our city. It has been my sincere honor to serve alongside Chief Saunders, and I wish him all the very best in his more than well-deserved upcoming retirement. Thank you.
Thank you, Chief. Before we go to questions, just to let reporters on the line know that city staff joining us today are Mary Ann Bedard from Shelter Support and Housing and Paul Raftis from Senior Services and Long-Term Care. First question is to Haley Cooper from News Talk 1010. Go ahead, Haley.
Thank you. My first question is for Mayor Tory. We want to know, where is the Police Services Board in terms of finding Chief Saunders' replacement? Did that process begin when Chief Saunders signed his one-year extension, or is that process only beginning now?
It actually had just begun a couple of weeks ago, because one of the first things you do, of course, in these instances is to get the help of a search firm, and we had just decided as a Police Services Board to do that maybe a month ago, and that would be the very beginning of a process that takes quite a long time when you look far and wide as we do, plus inside the service to see who is available. So obviously that process will have to be accelerated to some extent, although I would expect that you'll see the board likely appoint an interim chief following the chief's retirement on July 31st, and then move to carry out the selection process in whatever time it takes to make sure we find the best person for the job.
Thank you. And my follow-up question is for Dr. de Villa. Regarding the city possibly entering the second stage of reopening by June 19th, how feasible is that date, especially considering some of the comments made during your presentation to the Board of Health this morning that the transferring of testing information between provincial labs and Toronto Public Health remains a challenge, and that the ICU bed capacity and acute care bed occupancy rates are still below established goals?
So Haley, actually with respect to the current hospitalization data, they are in the appropriate range where they should be. There are certainly challenges, you're quite right though, with respect to the transfer of data from laboratories, and these are big system issues that require system fixes. However, we have put in a number of measures in place at Toronto Public Health in order to address those circumstances, but that doesn't preclude the ongoing conversations that I hope will continue to happen with our provincial counterparts and with our laboratory counterparts to try and address the system issues that require system fixes. However, I would also add that we have been working at Toronto Public Health along with the City Office of Recovery and Rebuild since late April on preparing for exactly this moment in order to restart and reopen, as we expected that this would be part of our process. It's part of the COVID response, it's part of the COVID recovery process, so we feel that we're prepared and have been working towards this moment for several weeks now.
Okay, thank you. Next question is to Dave Ryder. Sorry, not Dave. Apologies. Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. I was just wondering, because we are in such unique challenges and circumstances when it comes to the GTHA, when it comes to the restart, I'm just wondering if there are any specific unique solutions or ideas that you're looking to put forward to try to help speed this process up. We've talked about mandatory masks on transit. I'm just wondering if there's any consideration to make those mandatory elsewhere.
So I'll take the question. I think there's a lot of conversation in respect of how best to provide appropriate precautions so that we can live safely with COVID-19. We should expect that until we get effective treatments or a vaccine, that COVID-19 will be part of our community environment, and we need to learn how to coexist safely with this virus. So with that in mind, the mainstay of protection against COVID-19 for all of us is physical distancing. This is what's actually driven in the evidence. We know that face coverings and face masks are helpful in those circumstances where physical distancing can't be maintained. And for some of the conversation that I had with our Board of Health today, we also know that there are a number of different efforts that we can work on together, and I can tell you that we are already working on together local public health units all around the GTHA, focusing our efforts on those areas where we can prevent upstream the acquisition of infections. So we know that there are certain environments that lend themselves to more spread of disease and to more spread of COVID-19, where you have close contact, where you're in a closed environment, and where there are people, crowds. These are the environments where we know COVID-19 is more likely to transmit, and these are the areas that we need to work on together with our provincial counterparts and other local public health units in order to prevent spread.
And Matt, if I can add to that, the recovery, the roadmap process that we put in place includes a number of detailed assessments that the division or agency lead completes as they're moving through the restart process. That includes things like full public health assessments, personal protective equipment assessments, occupational health and safety assessments, staffing plans, and a number of other related assessments like that. So we certainly recognize that restarting any service level in a city as big and as complex as Toronto is no small task. But like we've talked about in our remarks earlier, the process that has been put in place is robust. Our team from the Office of Recovery and Rebuild worked directly with each agency or division lead on restarting those processes, ultimately culminating with a final review and approval, if you will, from the Strategic Command Team. So a very robust process that's put in place that includes assessments of things like PP, as you discussed, and many other elements.
And just as a follow-up question, because this is a regional approach to reopening, I'm just wondering if there are added resources to bylaw to start patrolling just to make sure that there is no confusion over businesses that are opening who think that they are actually allowed to reopen.
I would say that there aren't necessarily additional resources, so not a circumstance where we're adding to the resource complement, but as you've seen throughout our response to the COVID-19 pandemic, all of that activity is coordinated on an enterprise-wide or a city-wide basis. There is direct coordination, and as I could have actually added, one of the assessments that is completed as part of the restart process is actually an enforcement assessment. So making sure that we're paying attention ahead of time to what if any, their enforcement challenges will be there, and then of course connecting directly with the independent enforcement agencies, be it municipal licensing and standards or Toronto Police or public health enforcement, as the case may be, to make sure that those plans are in place, that they're robust, and that we're prepared to manage any enforcement issues that may arise.
Okay, thank you. Go next to Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Thanks, Brett. First to the mayor, I wonder if you could talk a little bit about the current climate, the issues, not just with the pandemic, but with the protests and the issues that have been raised. What sort of leader does the Toronto Police Service need now to replace Chief Saunders?
Well, I think we need someone who is very sensitive to what are incredibly complex challenges involved in running what is not only the fourth biggest city in North America and keeping it safe, but also the most diverse city in the world. This presents many policing challenges and many other challenges that require a great deal of sensitivity, a great deal of understanding of some of these issues and histories that have led us to where we are today, and the continued prevalence, for example, of anti-black racism in our community. But at the same time, you also have to know how to run an organization that is devoted to the public safety of the city and that includes a much heightened level of concern about things like mental health and how to handle people who are experiencing crisis. So it's an unusual person that you find that is qualified for these jobs, and I can only assure you that having been through this once, I will be a participant in this, looking for the very best person we can find, inside or outside of the Toronto Police Service, to bring that sensitivity, to bring about the continued change that Chief Saunders has begun, so that we can be a leader when it comes to policing, to community policing, to policing that is trusted, and to policing that is seen as a model around the world.
Thanks. And if I could just direct my follow-up to Dr. de Villa just quickly. I wanted to see if you could clarify a little bit about some of the stuff in your presentation this morning that had to do with the province's testing strategy. You're calling for a clearer testing strategy. They did put out a document that outlined their testing strategy. Can you get into a little bit about what's wrong with it and what you'd like to see different?
Well, you know, Jeff, I'll start off with a few basic points. And I think first and foremost, the issue is not so much one of numbers. There is a focus on testing numbers, and it is important to test sufficiently. But it is actually about how you use your testing to augment and to supplement all the other aspects of public health action, which include case and contact management and tracing. So a more coordinated approach, one that actually takes into consideration how these different elements support case finding and how we actually use the information for case finding to not only detect transmission, forward-going transmission, how one person who currently is a case might have exposed other individuals and preventing transmission there, but also moving upstream to look at where are the risk areas, where are people actually acquiring their infection, ensuring that we're testing in those areas so as to minimize and mitigate spread from those areas. So to my mind, less focus on the numbers, more on a coordinated strategy so that we can do the very best we can in terms of reducing virus spread.
Okay, now we'll go to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, this is for Mayor Tory. Mayor Tory, a couple of councillors are going to propose that the police budget be cut by 10%, which is about $122 million, and that money be redirected to community-led alternatives. Can you comment on that and whether you will support that or whether you will have your allies vote against it?
Well, I would just say this. We are looking each and every day, whether it's the police budget or any other budget, especially now when we have financial challenges in front of us, at ways in which we can do things better. And I take note of the fact that in the cause of trying to address anti-black racism and other forms of racism that exist in the city and to try and improve the trust in policing in our city, we've taken a number of steps, whether it was to bring about the end of carding, whether it's the introduction of a great deal of additional training on sensitivity to these issues, including mental health as well, or whether it's the speeding up now of body-worn cameras, where while we're just going to do it this year, we're well ahead of many other municipalities in Canada as a tool to improve accountability. So we'll take a look. I'm looking forward to working with the members of City Council as we look ahead to the 2021 budget. People sometimes forget that under my watch, the budget of the police service in the fourth largest city in North America and one of the safest cities in the world has gone up on average 1.6% per year, below the rate of inflation. 2 of those years, 2017 and 2018, we had a 0% increase, the first time that's ever been achieved 2 years in a row in the City of Toronto. So we'll keep looking, and we'll keep finding ways to make sure the city stays safe, but also to make the investments we have to make in increased sensitivity to people in crisis, increased sensitivity to the need to restore trust in policing. You know, I'll point out one more thing. I mean, the increase that took place in the police budget for this year was as a result of our investing in things people really wanted to see us do. Many more community police officers, for example, who were walking a beat, getting to know people, restoring trust in the neighborhoods. A special unit restored after having been canceled in 2012 to look after traffic enforcement that people called for and wanted us to do. New police officers to increase the activities of our police service and all of our first responders in neighborhoods where we've had various issues confronting us. So these are things that were funded by this year's increase, but we're going to go back and take a look at it. We'll do it in a collaborative manner with the police, with the city councillors and others, and come up with what is the best budget we possibly can to make sure the city stays safe and stays sensitive to the issues that we're very familiar with.
Okay. Thank you. And a follow-up also to you, Mayor Tory. I was just hoping you could elaborate on your comments this morning about when we could see police officers wearing body cams. You've talked about the summer. Would that be all of the force or only some people? Also, what do you think the cost will be? And can you comment on the fact that people say they aren't as sometimes promised in reducing police behaviors that could be harmful?
Well, this is the challenge of jobs like mine and like that of the Chief of Police or the members of the Police Services Board on a host of issues, is that you have a lot of people calling enthusiastically, energetically, and in a determined way for the installation of these cameras on people so that we can have a more complete record of what goes on when a police officer is carrying out their duties. And then you have others who would say they're less effective. And by the way, this year's budget, one other thing that was in that increase of this past year's budget is the money for the body-worn cameras. I myself believe, based on the pilot project we ran, that these will improve accountability, reduce complaints, and have a record that is going to be very useful to us in restoring trust in police and making sure that they can carry out their job effectively and sensitively. The timetable, we are in the process of trying to speed up, and the Chief and I have agreed that the objective is going to be to have one of those cameras on every single police officer in the Toronto Police Service by the end of the year. By talking about summer, we believe we can start to have it on some of the first groups of police officers by this summer. That's going to mean speeding up the conclusion of the procurement process and having it all dealt with at the July Police Board meeting, which I think we can do. I've requested that that be the case, and the board chair has agreed to put it on the agenda. We're going to agree to get all of the documentation and other aspects of this pulled together and just get on with it, because I think that's what the public want to see, and that's what we're going to try and deliver for them.
Okay, thank you. Next, we go to Scott Lightfoot from CTV News. Scott, go ahead.
Thanks, Brad. Question for Dr. de Villa. Officials in Hamilton have seen a pretty dramatic increase in the number of people in their 20s who have now been confirmed with COVID. And it looks like the same thing sort of happening in Peel and York, where the 20-somethings now have the highest numbers when you break down confirmed cases by age. Is Toronto seeing anything similar involving young people, and does this cause you any concern?
So, Scott, I don't have the specific details in front of me, but in speaking to our data people over the course of the weekend, I do understand that those impacted by COVID-19 in recent weeks here in the city are a younger demographic than was seen earlier in the course of our outbreak. Does that give rise to concern? I think any amount of activity of COVID-19 gives rise to concern, and it should, to those of us who are working in local public health. But what it comes down to is, again, the best way to protect oneself, the most evidence-informed approach to preventing the spread of COVID-19, to protecting oneself and the people around oneself, is physical distancing. And this applies as much to young people in our community as it does to those on the older end of the age spectrum.
Do you think that the numbers could be, in Hamilton they seem to think that perhaps the numbers are due to younger people sort of getting lax with the idea of social distancing or hand washing, that kind of stuff. Dr. Yaffe this afternoon was saying that she's sort of seen an increase as well in younger people, but she thinks it might be more due to younger people going to get tested now that you don't necessarily need symptoms. Do you think it's a bit of both, or what would your guess be as to why there seems to be this trend from the older group to the younger group?
Well, Scott, I try not to engage in guessing or conjecture. I prefer to look more at the data and understand what is happening. So without having actually had that look myself, or having had the team at Toronto Public Health look into the data to understand what we are seeing, I think it's just speculation to talk about. And these are hypotheses that I think are worth exploring. And that's important in terms of guiding public health actions. We must always look at our data, understand what the best available evidence is, and then make decisions in that regard, following the data, following the evidence. So certainly we know that physical distancing makes a difference. If our data suggests that physical distancing is not being as diligently practiced by younger members in our community as it should be, then I think we'll take our actions and direct our actions towards addressing that situation. But first and foremost, we look at the data and then figure out what to do.
Okay, thank you. Final question is to Richard Warnica from the National Post. Go ahead, Richard.
Hi, Dr. de Villa. I have a question about contact tracing, specifically in hospitals. If a patient is diagnosed with COVID-19 while in hospital and remains in hospital, does the contact tracing from public health begin right away while they're still being treated in the hospital?
So I think we have to look at, if you're talking, people use the term contact tracing, when in fact what we're talking about is a combination of case investigation and the subsequent contact tracing. Whether we actually speak to somebody while they're in hospital will depend entirely on what the clinical condition is for that individual, and whether we're able to obtain information in respect of that case through the contacts that we find. So I think without taking you through an entire journey of case and contact investigation, let me say this. When we get the information and are able to actually discern the positive result, which individual is affected, and to ensure that we actually have contact information, we contact that individual, understand how they might have been exposed to the disease, and understand who in turn they may have exposed during the period that they were infectious. We then go to follow up with those who are deemed to be close contacts and are therefore at highest risk of having been exposed and are at highest risk of going on to develop COVID-19, so that they're made aware that they've been exposed and they know what to do should they develop signs and symptoms of COVID-19. That's how we prevent future transmission. And this is what we do every single day in Toronto Public Health when it comes to communicable disease prevention and control, whether it's COVID-19 or any other infectious disease.
Just going to do a slightly different direction for my follow-up. As we're preparing for phase 2 of opening up, presumably in concert with that, you're preparing for how to cope with subsequent outbreaks or subsequent waves. Having now had the experience of having dealt with this once, what to you are the critical areas in Toronto Public Health that need to be improved heading into a possible second wave?
Well, I think that we're constantly endeavoring to improve every aspect of our response to this, or frankly, our response to any public health issue. What we have done in respect of case and contact management in particular is we grew our staff. We had, at the very, very beginning of this outbreak, we had 50 people working in case and contact management, and that's quite sizable when you compare that to other public health units all around this province, and I would dare say around the country. We are now at more than 550 and still growing because we know there's need. We have also introduced a new case management system in order to facilitate our ability to do case and contact management in a more timely and effective manner. And we are continuing to engage with our assessment center partners and with laboratory partners to try to find ways to make the flow of information and to identify those who actually have positive results or those who are at risk of being COVID-19 cases, those who are strongly suspected to have COVID-19 cases sooner, so that we can start the investigation sooner and do the contact follow-up sooner. So these are just a few examples of the kinds of things that we're doing. And as we discover more through our case management and our contact management efforts, we continue to develop new pilots and new methods and new approaches so that we can continue to do this better and better.
Okay, thank you. That concludes today's briefing. We'll be back again here on Wednesday at 3:45 p.m. Thank you.